Hi, this is Dr. Kurt Woeller for Integrative Medicine Academy. I want to welcome you to this presentation. The title is Genetic Variants That Can Affect Those with Autism and Other Special Needs. Now, I'm joined in this presentation by Sharon Hausman-Cohen, MD, who is one of the co-founders of IntellxDNA. I'll introduce Dr. Hausman-Cohen here shortly. So our disclaimer is that you understand as a viewer that this information is for educational purposes only. We are not making a diagnosis of any disease or giving any specific treatment recommendations. I'll mention more about the Autism Mastery course towards the end of this presentation. The Autism Mastery course is a comprehensive course through our Integrative Medicine Academy that goes through many of the fundamental aspects of biomedical intervention for autism, and that will also include information with regards to genomic testing. So as I look back over the many years that I've been involved in the autism world, implementing biomedical intervention, also sometimes called integrative medicine for autism, many years ago, I developed something called the 4 pillars. And the 4 pillars recognizes that for anybody with an autism diagnosis or other special needs condition, we know that we have to address diet, that foundational supplements are very important, that digestive system problems are quite prevalent, particularly now with more knowledge understanding the implications of candida, clostridia, etc. And then there's this other aspect called methylation, which is a complicated area biochemically, but fundamentally, when you implement biomedical intervention within those initial areas, diet, foundational supplements, digestion, methylation, you often get great improvement. The other interventions box is a very large box. There's many other things that fit into that section. That could be hyperbaric, that could be heavy metal detox, cerebral folate deficiency interventions, etc. But fundamentally, we always want to start by understanding how important those first 4 pillars are. And so when we understand that autism is not just caused by one thing, that many things environmentally can impact individuals with autism and other special needs, again, from metals to nutritional imbalances to mold and mycotoxins to methylation problems, detoxification issues, chemicals, etc. There's a tremendous amount of positive things that can happen, including, in some cases, recovery from their diagnosis. What we didn't have available to us many years ago that we now do have is the incorporation of genomic information and how genetics can influence many of these individuals. But more than just the testing, it's the utilization of the testing tools and the research that has been put in to try to figure out what types of interventions are actually helpful for certain genetic variants that can be commonly seen in this group of individuals. So, Sharon Hausman-Cohen, MD, is the co founder, chief science officer, and medical director of IntellxDNA. She received both her master's and medical degrees from Harvard Medical School. She's board certified in family medicine and integrative medicine. She also is a fellow of the American Board of Integrative and Holistic Medicine and been in clinical practice for decades, both in family and integrative medicine. So before I finish this up, in the original recording to this webinar, Dr. Cohen introduced these following slides. It's about 3 more slides. And there was a technical glitch that occurred with that the early part of this recording was not recorded. So I'm going to do these next few slides, and then the presentation will transition over to Dr. Hausman-Cohen. So the core lecture from Dr. Hausman-Cohen in this presentation has to do with a young boy named Leo. And the original case actually comes from a Dr. Andrew Usman, who Dr. Cohen had worked with in implementing the IntellxDNA information to try to figure out what type of genetic variants were actually affecting Leo. And the other unique thing was that Leo had a lot of tests that were done. Organic acid testing was done, mycotoxin testing was done. So there's a lot of interventions that were also already implemented in his particular case. Now, IntellxxDNA has their own disclaimer and copyright notice, and it's important to acknowledge and understand that by you watching this presentation in any of its format, you agree that you will only use this information in this presentation to use in the care of patients and not for any commercial purposes. So you're not going to take it and go create another genomic tool or some other type of presentation. So again, it's for educational purposes. So as a quick refresher, it's important to understand what are SNPs, what is medical genomics. So a SNP, SNP, stands for single nucleotide polymorphism. And this is where a change in one nucleotide within a stretch of DNA or within a gene gets switched or changed. So in this particular case, adenine gets switched out for guanine or vice versa. So just that one switch or change is a single nucleotide polymorphism. And a very simple way of thinking of this is SNPs are equivalent of a one-word change in a recipe. It doesn't mean you couldn't make the meal that you're making, but it may not come out exactly the way you wanted with a particular ingredient that was missing. And why that's important is that genomics is where we get small genetic events that by themselves are not disease causing, but can be disease contributing. And so these genetic variants in DNA can create changes in the body that makes an individual more prone or even less prone to certain diseases. And this is always generally in the combination with other diet exposures and lifestyle factors. Now, genetic diseases like cystic fibrosis or sickle cell disease, these are inherited conditions, okay, that could either be dominant or recessive that manifest right away as a disease state. But a genomic variant, again, is just creating changes in the body that may make an individual more prone, but it's not necessarily always going to be the case. We're always taking into context lifestyle, diet, and other environmental exposures. So let's move on to Dr. Cohen's presentation.
So conventional medicine tends to focus on giving a diagnosis and then going, use this prescription medicine or this treatment for this diagnosis. But genomics is really much more in fitting with an integrative or functional medicine approach, where we're looking for the root causes of disease, and we understand that there can be many roots, and we're addressing them. It allows for a precision type personalized plan. The report that we're going to be showing some excerpts from is IntellxDNA's neurodevelopmental report. So our neurodevelopmental report uses what I call, we were calling it the mental wellness backbone. We're now switching it to foundations of pediatrics and mental wellness, so parents don't think you're accusing their children of having a mental illness. Mental wellness is important for everyone. But this panel and this grouping of genomics was designed with neurodivergent children in mind. In fact, the whole reason we added ADHD and OCD and started putting in mental health pathways is because they're often comorbid with autism. We also have specific panels that focus, and a panel is a collection of SNPs that have a common theme in terms of what they're related to. So we have specific panels that focus on pandas, folate receptor antibodies, and other neurodevelopmental issues. So again, very specific for the pediatric world. I'm going to just give you an orientation to how it works, and then we'll jump into a case. IntellxDNA was meant to be a clinical decision support tool so that you as a clinician can make better decisions. So many of you from doing organic acid testing or other things know that aldehydes can go up because of yeast overgrowth and all kinds of other things. Certain foods can increase formaldehyde or aldehyde production. And you need this gene, ADH5, to remove those aldehydes. If you can't remove it, then formaldehyde builds up in the brain. And higher levels of formaldehyde are associated with autism. So that's kind of this key point up at the top. And then you can click and go, well, what's clinically significant? In this case, it gives a 50% increased risk of autism if you have 2 copies. And then you can click potential interventions and see that we're going to give you supplements, diet, and lifestyle interventions, all that can help address this SNP. So let's go to the case.
Real quickly
Yes.
on that one last SNP. We had mentioned this before. Does that particular SNP, do you know that that enzyme affect acetaldehyde? I know we talked about formaldehyde, but does it affect acetaldehyde?
I went and researched that for you. Yes, it does. It's both acetaldehyde and formaldehyde. And so, yes, I had not thought about that until you asked me that question. So I can actually add that into the blue so it is clear for people who are using it.
And that's really significant for people to understand, because we know that in autism, candida is a major problem. And one of the compounds that gets produced by yeast metabolism of glucose is acetaldehyde. And that is a major negative influencer on the methylation cycle. So very interesting.
Yeah, that is really interesting. And I'll have to learn from you as well how it affects the methylation cycle, because that is something I didn't know. Okay, so let's go to this case study. And we call this case Leo Born to be Wild. And the reason it was born to be wild is you're going to see that this child had just a lot of stimming, a lot of flapping, a lot of high energy activities before his genomics was addressed. So this is a 4-year-old male with autism, very hyperactive and fidgety and stimming, chemically sensitive, has a lot of POTS type symptoms with autonomic dysfunction. And he'll get flares of OCD symptoms when he gets sick. So we were really thinking a panda's PANS-like picture, but he's also not just sensitive to chemicals, but also supplements. And the really interesting thing is even sensitive to some of the anti-inflammatories and to a number of the probiotics. And when he gets intolerant, he will get worsening hyperactivity. As a baby, he was carried by a surrogate. His mother is a physician and needed help with fertility and had a surrogate. The surrogate had preeclampsia and got various vaccines, amalgams, but he was actually doing fine at 5 months. He was moving a lot. At 11 months, he walked, had 10 words. And then at 12 months after his MMR, he got a high fever and had regression and lost all speech and eye contact and stopped even responding to his name. So then he was diagnosed with autism. At 17 months old, his testing showed dysbiosis with low butyrate and high propionate, overgrowth of Klebsiella and Citrobacter and strep, abnormal chem panels, and I'm going to show you those, ChemTox, but negative hair analysis for toxic metals. So I'm going to let you, Kurt, kind of walk through the OATs testing a little bit. There's 2 pages of it, but let's start with this page.
Yeah, we get into this in great detail in the course. And if anybody's taken my OATs seminar through Mosaic, you've probably seen some of these markers before. When I saw these tests originally, that's an extremely high oxalic acid. So one of the things to be concerned about is fungal production, so which we know can occur from Aspergillus. Candida can actually produce oxalic acid as well. The lactic is very high, so we've got some interference with that pyruvate dehydrogenase. And then there's just a number of elevated Krebs cycle markers. The succinic is concerning because that's very much linked to complex 2 of the electron transport chain, but it also links up within the Krebs cycle. And so that one is commonly linked to environmental chemicals, which I think you mentioned was a problem in this particular case. So yeah, there's definitely a lot of mitochondrial issues here that are significantly concerning.
Okay. And then this is the second page of his OATs testing. And you can see at the bottom, he has really markers that are consistent with low glutathione. The pyroglutamic is inverse. But you want to talk about the yeast and fungal markers?
Yeah, and real quickly on the pyroglutamic, the previous slide actually showed elevated citric. And elevated citric acid on the organic acid test is commonly linked to a glutathione deficiency. So what happens is you're getting a dysregulation in glutathione. There's an enzyme called aconitase, which basically is part of the second and third step of the Krebs cycle. And if that's deficient, you get increases of citric acid. Now, the oxalate was very high, so maybe wasn't eating a high oxalate diet. But you'll also notice that arabinose is high, so there is gastrointestinal candidiasis, and you also see elevated tartaric, which is linked to aspergillus. So that oxalate value is probably a combination of diet plus fungal production plus increased absorption. And then the 4-hydroxyphenylacetic is also elevated as an indication of Clostridium infection.
And then here he also does, as we kind of suspected from his OATs testing, have evidence of aspergillus. His aflatoxin M1 is high, and that can be an aspergillus marker. So that's,
yeah, so that matches up really well.
Yeah. So this, again, Dr. Usman Singh is one of the leading autism physicians in the country. She's been doing this a long time. So she did a lot of things. She did gluten-free, dairy-free diet, tried pomegranate powder, green tea, vitamin A, biofilm protocol, prebiotics, lots of different supplements, mitochondrial supplements, but she didn't get as much improvement as she wanted to. So this was kind of this plan at age 2. And that's where she was like, there's still more going on. So she ordered IntellxxDNA. And so the real thing that made her decide she needed to get the genomics with him is she really was like, he's getting all these worsening episodes after having a probiotic, sometimes even aggressive. And so she was like, this is time to order this. And a lot of our doctors will order IntellxxDNA right from the very beginning, especially if you're newer in your pediatric journey, because it's just going to give you a roadmap. This was a patient she was already working with. So she has a lot of established patients, so she didn't order it immediately on all of her patients. She waited and ordered it as they came back if they were not making progress. So let's look at his hotspot. So a hotspot is looking at the genomics. We're going to look at 600 or so SNPs, but you can't talk about 600 SNPs or even scan them. So the computer, the system, the clinical decision support tool is going to populate the less common SNPs and other SNPs that are highly clinically significant into what's called a hotspot. And we're going to go into some of these, not all of them, but the top one deals with gluten intolerance. This one that we like to call the Texas NERD2 SNP, it's the opposite of COMT, and so it makes you have lower norepinephrine and can contribute to that autonomic dysfunction of low blood pressure and such. This GST01 contributes to low vitamin C. The CACNA1C contributes to EMF sensitivity. CRP can contribute to infection response. So there's lots of goodies here, and I'm going to kind of show you how we use this. He's got also a SNP that contributes to low norepinephrine and high dopamine that gives 15 times the risk of ADHD. Neuroinflammatory SNPs, that high brain formaldehyde that we talked about, oxidative stress. So there's just plenty for her to work with. And so you don't have to start with looking at the whole report in detail, because you're going to start with that 80-20 rule. If you deal with the 20% of things that are most important, you're going to get 80% of the benefit. So that's where she started. There's actually,
I'm sorry, real quickly, interesting. One of the things that was attempted in this child was methyl B12, correct?
Yes.
And they just didn't, and they just didn't get the clinical response. So the child actually has that aldehyde SNP, which we were talking about, and they have a lot of fungus. Well, what the acetaldehyde does, it gets produced through yeast metabolism, is it inhibits methionine synthase. So it's a methionine, that particular enzyme is very sensitive to environmental chemicals, inflammation, oxidative stress, and I've seen that for years. Where you know, on paper you think, well, this is a kid that's going to do really well with methyl B12, and you implement it, and very little happens. And it's not until you address some underlying fungal problem that all of a sudden that system starts to kick in a little bit more. So that piece really, you know, is interesting to me, because that really fits the genetics.
Yeah, no, that's great. I don't have time to show all of his SNPs, but I also wanted to comment. Remember, we said that Dr. Singh addressed mitochondrial using some standard mitochondrial supplements. And the interesting thing here is he had some SNPs relating to mitochondria and neuroinflammation and folinic acid and infection and all kinds of things. But his SNPs relating to mitochondria were not ones that could be addressed with the classic symptoms. It was more of a mitochondrial shuttle that responds more to NAD. So we're going to get, that's kind of a spoiler alert, lots of interesting things. Now, you don't want to order tests unless you're going to know what you're going to do with the results. And so that's one of the goals of IntellxDNA has been, is our research has been to build a tool that not only tells you here are some root causes that might be contributing, but how does this gene variant work and what can you potentially do to intervene? And so that's where we really shine. For each variant, you will get supplements, lifestyle, foods, and even medications that might be beneficial because they're responding to that SNP mechanism. So let's start with something easy that Leo had. So Leo had this FGFR2 SNP, and this is associated with decreased absorption of magnesium in the gut, and so you get decreased magnesium levels. And of course, we know decreased magnesium levels have been associated with autism and ADHD. He had already been started on that, so he had been given magnesium glycinate and magnesium threonate combination, so that was good. Now, his hair elements really were supportive of what we were seeing with the genomics. This was his initial hair test, and you can see magnesium was almost touching the red. You're also going to notice copper is almost touching the red, and we're going to come back to that later. So it's nice when you have lots of data, but sometimes by doing genomics, you can actually get rid of some of the testing. There's no genomics that's going to replace OATs testing or stool testing, but you can often start with the genomics and not have to do quite as broad a testing. The next thing on his genomics that related to vitamins was a GST01, which is a glutathione transferase, but there's different glutathione transferases. This particular one is involved in recycling vitamin C. That becomes super important because vitamin C is a cofactor for norepinephrine synthesis, and low norepinephrine is super important for ADHD. Remember, we talked about his hyperactivity? Well, dopamine beta hydroxylase creates high dopamine, and I think of dopamine as the opposite of Parkinson's. So Parkinson's, you get that bradykinesia and kind of people can barely move. When you have problems converting your dopamine to norepinephrine, particularly when you have this combination and this SNP that's on the only 11% of the population, you're going to have high dopamine, which is that reward loop, do it again, and then low norepinephrine. And this also contributes to his autonomic dysfunction.
Was his dopamine, I missed that on his OAT. Was it elevated or high normal?
It was high normal, but she had already given him vitamin C before she did that.
Okay.
So I think had she tested it before she corrected his vitamin C, it would. I've had some come back on people where the OATs testing was done as the very first thing, and it correlates really well. We have a number of them where that correlates with that.
And he also had the Clostridium, which is a suppressor of dopamine beta hydroxylase too. So you add that on top of the genetics.
Yeah, no wonder this kid was hyper. Absolutely. Yep. So this is just to refresh. So in order for you to make norepinephrine from dopamine, you take vitamin C as the cofactor, and then you use the dopamine beta hydroxylase is in here. And we're going to get back to this copper enzyme later because it's kind of an interesting story as well. So, actually, we're going to get to it sooner. So this ATP7B is a benefit in that it helps you protect your brain against too much copper. And that's really important in adults because over time, when you're exposed to hormones, especially estrogen, we tend to build up more copper. But children who have 2 copies of this SNP, as you can see on this pop-up, you want to check copper levels because it can be the opposite problem. They can have too low of copper, which is necessary, not just for norepinephrine, but also the immune system. And remember how he was getting this pandas-like picture where he'd get sick and he'd get worse. And so we definitely have to deal with those infections. And you can see again on his essential elements testing, his copper level was low. So it's very fun when it all correlates. And so we kind of already talked about dopamine beta hydroxylase, but that low norepinephrine and low adrenergic tone can contribute to his hypotension as well as neuroinflammation. Now, different SNPs have different associations because each SNP interacts slightly differently with other genes and in the genome. And this particular gene is common, but it is one that is associated with a higher autism severity score and more repetitive behaviors. So we know we've got to kind of get his norepinephrine up if we're going to stop that stimming. So sometimes it's not about giving pills. Sometimes it's just about giving foods. Sometimes it is supplements. It depends on the kid. You know, if you can get enough in their diet, great. If not, you can use supplements. But there's other ways to address dopamine beta hydroxylase as well that you can learn about from the IntellxDNA report. And it's going to remind you. It's kind of sitting there as your training wheels to remind you with each patient how you can uniquely address them. And it's pycnogenol. And pycnogenol is great because it increases the synthesis of glutathione, decreases dopamine, and it is also a benefit because it increases endothelial nitric oxide production and reduces oxidative stress. But it doesn't do the job of raising norepinephrine. But just to help suppress some of that dopamine, and it has good studies in ADHD, that was added. Glyphosates are also important to talk about with parents who have DBH SNPs because glyphosates can really change your gut microbiome. And I'm sure that Dr. Woeller gets into this in much more detail than I'm going to get into. But what happens is some of the good bacteria are killed off, and then some of the bad ones, like Clostridia, are able to survive, and some of the and others as well. And so when you see high Clostridia on oats testing, you got to get rid of glyphosates as well. Did you agree, Kurt?
100%. Yeah, interesting too about his oat. I just read one of Stephanie Seneff's books, Toxic Legacy. She mentioned that glyphosate is actually an electron transport chain inhibitor as well. And I think, if my memory serves me, it actually inhibits complex 2, which would raise succinic acid on the oat.
Yes, I gave a talk at MAPS that we went into some of the details on glyphosates, and I'll be happy to share those slides with you so you can share them with your course because I pull if you don't already have them in there. So exercise. What else can we do to support low norepinephrine? Exercise. You know, we're not likely to get a 4-year-old to do cold water plunging, but you can take him swimming in summer or even in the fall. You can use carnitine, and that's going to also increase norepinephrine and serotonin. You don't want to give tyrosine because it won't help. It'll help make more dopamine, but not convert it to norepinephrine. Now, the next step is another benefit to having adequate norepinephrine is without adequate norepinephrine, you can't suppress brain inflammation. And so let's go on to talking about some of the more inflammatory pathways and a little bit of norepinephrine relating to COMT. So COMT is what I call one of those pop genes. Everybody's heard of it. And you can have COMT and have more norepinephrine, but there's a SNP that's called Texas NERD, or the thioredoxin, that's the opposite of COMT, that makes it so you metabolize the norepinephrine more quickly. And so this is associated with lower blood pressure, and he's got that. So to increase his norepinephrine synthesis, vitamin C, pycnogenol for the DBH to kind of help lower the dopamine, avoid glyphosates, try to do what you can to increase his blood pressure. Salt is a really good, important thing. If anyone has mast cell issues, salt also helps to inhibit mast cells. With regards to that inflammation, we know inflammation is a big contributor to autism. There's studies showing more swelling around the brain, even on ultrasounds of young children with autism. And this child had problems with increased CRP synthesis in the presence of infections. It can also relate to heart disease in adults. But when you have higher CRP, when you get an infection, though it may not necessarily be true pandas or pans, this child did not end up having any antibodies. But the CRP, when he gets an infection, will skyrocket because of his genomics. That will increase the blood-brain permeability, and that will create more neuroinflammation. So that is probably what was going on. And we see this. You give the kids a flare protocol with high dose omega-3s or something to lower inflammation, and it sometimes helps. But he also did have some SNPs that contributed classically to pandas and pans, even though he didn't have the full antibodies to strep. And that is TNF alpha is a big factor for pandas and pans. And think about TNF alpha is affecting barriers, blood-brain barrier, blood-gut barrier, and the vast majority of pandas patients will have this TNF alpha because it's also a huge part of autoimmune. Think about rheumatoid arthritis and psoriasis. TNF alpha inhibitors are given left and right in autoimmune disease. But the new kid on the block is mannose-binding lectin. And mannose-binding lectin is also important for autoimmunity and pandas and pans.
By the way, how often do you see the TNF alpha? Because I tend to see that quite a bit, and so
Yeah,
assuming it's pretty common.
Yeah. So it's 25% of the population, and with one copy, you get a 50% increased risk in pandas. However, where you're really going to see those kids where they're Cunningham panels positive and where it's, they've already created antibodies is when you have the AA type, and that is less common. That's only about, I think, 9%. And in the study, it was a study of about 100 kids in each arm. It was like 86 in each arm. Some people had dropped out. And they had no one in the control group who was AA, and compared to 86 people out of the 90-some patients, 86 of the people with pandas had AA. So if they'd had one in the control group, the odds ratio would have been 86. But because they had none, we just know the odds ratio is higher than 86 times increase when you see two copies. So it's a big deal. It also is the same gene that increases your risk of celiac disease by 6.6 times, which is 560%, which again makes sense. We know that autoimmune disease and gluten intolerance go together. So since mannose-binding lectin is kind of a newer SNP that many of you have not heard of, the way to think of it, to explain it to your patients, is we have to kind of paintball our viruses, our bacteria, our yeast. Remember his fungal overgrowth? We mark them, and we mark them with the help of mannose-binding lectin. It kind of pokes holes in these different viruses, bacteria, yeast, etc., even spirochetes, so that the immune system can better start to break them down and recognize them. So I think of it as like the soldiers, but instead of bullets, doing a little paintball action. And so he was less able to identify infections, so he got worse infections. And those kids that have two copies of the mannose-binding lectin SNPs, they get really sick really easily. Those are the kids that keep getting the severe strep infections with the high fever. But remember, when Leo got his vaccine, he was one of those kids that got a high fever and big response. But he had other SNPs that contributed to inflammation. And again, we're classically taught, for inflammation, we want to give omega-3s. That's great if your inflammation is certain pathways, some of the interleukin 1s. But Leo's inflammation, one of it was higher TGF-beta. And there's really a multitude of types of inflammation that you'll learn about when you study genomics. And they all have different interventions. So just like if someone came to you and said, hey, doctor, the patient in room 2 has an infection, what do you want me to prescribe? You would need more information. Is it a virus? Is it a bacteria? What bacteria? Is it Lyme? And so when you have a brain that's having inflammation, you need that genomics. You need more information as to what kind of inflammation, because with the blood-brain barrier, you can't measure blood levels and know what's going on in the brain. So TGF-beta type inflammation is particularly known for fibrosis and scarring, but it also is involved in microglial differentiation. And microglia, of course, are the garbage collectors of the brain. And then when you have gut and environmental stuff going on, that can also affect the microglia. So all of these things together absolutely affect autism. What else does high TGF-beta levels lead to? It can increase your risk of autoimmunity, and it also can make it so it's harder for you to turn off your inflammasomes. You can have increased NLRP3 and increased IL-17 in response to TGF-beta, so you dramatically can increase your autoimmune risk.
Hey, real quickly, Sharon, on the interleukin 17, that's something that tends to get triggered a lot with mucosal infections. So most of these kids, again, I go back to the gut, right? So you've got fungal infections, candida, invasive candida, clostridia, interestingly enough, also engages that same type of immune response. And so dysregulation in that Th17 interleukin 17 system will also have a suppressive effect on regulatory T cells that increases that autoimmune either reaction or can cross over into a disease. And going back to the TNF alpha aspect, you mentioned it's pretty highly prevalent in general population, and where we can see that it has a lot of clinical significance for these kids with their brain on fire is that those infections, candida as well as clostridia, are major inducers of tumor necrosis factor. In fact, I'm working on some information now about how clostridia can interact with different toll-like receptors and trigger those types of cytokine productions. So a lot of interesting information, but the more we know and the more we study now the immunology, the biochemistry, and now what you're bringing to the table with all of this genomic information, it's just opening up the world of information and also interventions to really help these kids in ways that we've not been able to do for a long
Yeah,
time.
it
It's
is
really,
really
really
fun.
fascinating.
Yes, I feel like together we can really make a difference for so many children. And again, the fun thing, when you have TNF alpha, there's things like lion's mane mushroom that you wouldn't necessarily have your go-to. When you have TGF beta elevation, cinnamon becomes a really great intervention. Curcumin, ginseng, resveratrol to inhibit those NLRP3 inflammasomes and downstream. So it allows you to have a precision plan. So what was chosen for this child, for the CRP to lower it, CoQ10, magnesium, vitamin D, sulforaphane, ginger. Sulforaphane does a lot of other things, so a lot of times it's a good base. If you don't know someone's genomics, it's a great base because it can affect detox and inflammation. For the TNF alpha, lion's mane. And again, this child was really sick, so the mother was willing to give him 10 or 15 different things. Silymarin, baclin, mannose-binding lectin. Palmitoyl ethanolamide is a good option for that, as well as resveratrol works, but she chose the PEA. It comes in chewables and butyrate-rich foods, and the ginseng and cinnamon. So I just want to take a moment to talk about his hyperactivity with probiotics. So it was a clue, actually, retrospectively, because high dopamine creates increased motor activity, and some probiotics raise dopamine. So that is probably why he flared with certain ones. Lactobacilli rhamnosus and planetarium are both used a lot in children's probiotics because they're good for allergy and mast cell. But this child wasn't a mast cell child, it was a dopamine kid. And both of these can inhibit dopamine breakdown. And then, of course, he had the clostridia that we've talked a lot about. So if he had been a mast cell kid, those would have been great choices. Lactobacilli rhamnosus also increases glutamate, which could have added to his excitatory. Now, eventually, his excitatory phenotype. Eventually, with lactobacilli rhamnosus, GABA gets increased as well, but it takes longer. So sometimes you have to start low, even with probiotics, which is interesting, because it took up to the 4th week before GABA caught up with the glutamate. And again, all of these things are things that are they're embedded in the genomics tool and in educational platforms that you guys will have access to as well as a bonus when you're working with Dr. Woeller. So choosing a probiotic for Leo, we want one that's going to increase norepinephrine, but also serotonin. So Leo has SNPs that lead to lower serotonin and serotonin signaling. I always say that serotonin is what you feel when you're holding a puppy, and that is why I have that very cute puppy here. So we want what probiotic's a good choice? Lactobacilli helveticus is a fine choice because it is associated with improving anxiety, and it increases the anti-inflammatory cytokine IL-10 and also increases norepinephrine and serotonin. So that's what she switched him to. Saccharomyces boulardii was the other one. And you can put probiotics and learn to make probiotic yogurts. And so you can take a couple capsules, grow it in coconut milk in a yogurt machine, and have probiotic for 2 weeks.
But Sharon, did you mention the previous probiotic it affected serotonin or norepinephrine? I missed that.
Both. That was the cool thing.
Okay.
So yeah, so that was one of we actually, so Anju and I had after she had the child flare with the probiotics and we realized what was happening, we kind of started doing a deep dive as to what probiotic would be the best for raising both of them. And so it was kind of a fun thing to search the literature for. So Saccharomyces boulardii is also great. And it also lowers LPS-induced anxiety. So again, with him flaring with infections, those were the two that we recommended for him. So Bifido infantilis would have been another one that also can increase norepinephrine, but we chose the other two. I think she might have used a combination, but avoiding the ones that make dopamine go higher. Side note about folinic acid, Dr. Woeller already gave you some information, but folinic acid will feed the pathway for synthesis of dopamine, and that might have been part of the story, or it may have been that he wasn't ready to handle it because of the gut stuff that it was affecting the methionine reductase. But either way, if you have a child flaring with any of these B vitamins, sometimes you have to back off and go slow and address all the other stuff like gut and inflammation first and then retry. So all the kinds of things you can do we talk about the probiotics. I'm going to talk about two more genes. One we already talked about, the ADH5, but I want to talk about CACNA for a second because CACNA is a calcium voltage gate channel subunit alpha 1C. But the cool thing about it is it makes you EMF sensitive. And I think it's cool that there's a SNP associated with EMF sensitivity. And so microwave EMFs can lower norepinephrine in people who are EMF sensitive. So again, it was compounding this. So low intensity EMFs are not so bad for norepinephrine, but when you get to higher levels, such as with flying, then you can start to get neuropsychiatric effects. Sorry, my computer is, I think. Okay.
So you mentioned it's causing a calcium. Is it a calcium dysregulation in the cell? Is it the way things are flowing into the cell or how things are being exported?
Yeah, so think of, how we think of like calcium, efflux and such can regulate glutamate and all of that. And so it's one of those dysregulations. It's associated with bipolar as well, CACNA channels. And it's just, I tell my patients, it's almost more related to almost like the brain seizing. You just get too much electricity flowing in. And that's probably why lithium helps. Lithium specifically addresses CACNA 1C and also antagonizes dopamine. So that was chosen because of the combination of his CACNA SNPs and some of the dopamine and such. We talked about the aldehyde, alcohol dehydrogenase, and the formaldehyde, but also other chemicals and the candida overgrowth. So now we're kind of going, gosh, we've got so much going on. One of the things to remember is you don't have to address every single SNP at first. You choose what makes you think is the most important, and then you circle back. But with children, there are a lot of SNPs that you can address with foods. So you also want to always look. I've got a little bit cut off here, but you'll see foods that lower formaldehyde and break down formaldehyde and aldehydes: watermelon, pomegranate, tomatoes, and then to a lesser extent, papaya, lemon, onions, and mangoes. Well, those are, especially watermelon and pomegranate, those are pretty easy foods. You can make pomegranate juice popsicles or sodas, and watermelon's easy. So use foods when you can. And then decrease EMF exposure by turning off Wi-Fi at night. There are EMF blocking fabrics available that I don't know if his mother ever tried. We suggested it for when they fly. Lithium, etc. Cleaning up the gut, replacing glutathione. And so that was done. His last fun SNP was he had a SNP that makes him bind orexin more tightly. So he got 10 times greater hyper alertness. But that also relates to brain histamine. And I'm telling you guys a lot, and I don't want to overwhelm you. But again, this child had so much going on. So think of orexin as the opposite of melatonin. It helps you to be awake. Well, if you bind your receptor that regulates some of the orexin and histamine 10 times more tightly, and you get this over levels of brain histamine and orexin, that's a big problem for hyperactivity as well. So again, so there's a lot that, why did Leo do well on some things and not on others? Because you had to pay attention to what was going to decrease his dopamine. That was the biggest factor. So his key issues were too much dopamine, not enough norepinephrine, PANS and immune dysregulation, lack of some supporting nutrients, but you have to know which ones. So magnesium and vitamin C, yeast overgrowth, EMF sensitivity, overproduction of histamine, and then some other mitochondrial things that were going on. So after a few months after IntellxDNA, his ATEC went from 70 to 40, and he got a significant improvement in his language and vocabulary. He was able to start speaking in both English, Russian, and Spanish, doing some reading, still hyperactive attention with attention and focus, still flaring with some chemicals, and still not where they wanted to be, but it was just a few months. But the thing that I thought was really interesting is Dr. Singh was like, well, maybe we're missing something. Let's repeat the toxin test. So she did a provoked toxin test. And again, this is something that Dr. Woeller can teach you guys to do. So you can learn about, but on provoked, you're going to see the stuff that's kind of stored deeper in the tissue. And remember, his hair mercury analysis was completely normal. But look at it. With provoked, it was really, really high. And his lead was high. So that was interesting. So the question was, where did he get exposed to it? I don't know the answer to that right now. But she did a number of chelation treatments, like 5 IV chelation treatments. I think she actually ultimately did even more of that. She did 10 IVs ultimately, but got dramatically better with 5, but they kept going until they got him completely cleared. And that ATEC that had been 70, that had gotten to 40 with genomics, then with that last step of getting rid of the mercury and lead, got down to 20. And so he is now starting mainstream kindergarten, stopped going to ABA therapy a long time ago, refusing it on his own, saying that he didn't like it. And family, of course, is very happy with this. He's astounding his family. So if you are interested in adding IntellxDNA to your practice, we can send you a follow-up email as well, but you can also just scan this QR code or go to IntellxDNA.com or email Clove, which is Christy Love at IntellxDNA, 2 L's, 2 X's, and mention Dr. Woeller, and you will get fast-track training, be able to order your first report, actually your first 5 reports at a discount, depending on how quickly you order, but you'll get a discount for a period of time. And then you'll get enrolled in our Genomics University and our online training and mentorship program as well. And there is, even if you only order 1 report in your lifetime, there's no charge for us taking part in that. When you just mentioned Dr. Woeller, we're happy to get you guys trained. If you really want to jump into genomics, then join us at our annual conference. It's going to be great. We have a whole separate pediatric track, 10 faculty. And we would love to get you trained July 19th through 21st. Dr. Woeller is going to talk to you a bit more about his Autism Mastery course.
Sharon, thank you. That was fantastic. There's so much there. We could talk for hours. So let me finish this up, and then we'll go to Q&A. So we'll do some questions and answers because I know there's a lot of questions. So taking it back to what I had mentioned in the beginning about autism, we know that it's affected, these individuals are affected by multiple things, including the genetics, of course, mitochondrial metals, nutritional imbalances, and we get into all of this within the Autism Mastery course.
And you guys can, I'm going to forward it, but put questions into the chat if you want, and we'll get to them afterwards.
So the Autism Mastery course, so our Integrative Medicine Academy, it's been in existence for about 6-7 years. This course was the original course I developed. And so it is an extensive course, 16 modules. So there's hours of lecture material. Each lecture is presented live. We record it for later viewing. And then there's a lot of course documentation, intervention protocols, and then ongoing support. Each of our courses through Integrative Medicine Academy comes with a certificate of completion once you've completed the material. That also means passing the exams. The exams can be taken over as many times as needed to pass, but it's also another way of learning the material. So we go through all of these different aspects. And I open with this particular slide about the original 4-pillar approach, which is how I've always approached autism from a dietary standpoint, foundational supplementation, digestive assessment, and methylation. And then we have that other intervention box, which I mentioned too, and that we could stuff a lot of things in that: cerebral folate deficiency and hyperbaric and chelation and mycotoxin detox. But really, it's fundamentally important to understand those 4 pillars. And now with the IntellxDNA information that we can infuse into these teaching modules, it just expands our ability to understand things at a much more deeper level, understand where some kids have hiccups along the way where they may not necessarily progress with therapies that we originally thought would help, like the methyl B12 thing, for example. I thought, Sharon, what was fascinating about this particular case was the probiotic angle, right? Because
Yeah.
I see a lot of kids with elevated dopamine. So you look at the organic acid test and they have elevated homovanillic acid. Now, in many cases, it's linked to Clostridia, but not always.
Mhm.
And even in some of those kids where they have elevated HVA, so we're figuring there's something going on with the DBH enzyme, but they don't have Clostridia, but then they take regular probiotics, like you had mentioned, which was the plantarum and I forget the other one.
The rhamnosus also can make it worse, which is so
Yeah.
common because we always think anyone who's hyper is mast cell. And there are kids that are mast cell that would benefit. But yeah, in this case, it was not a mast cell child.
Yeah, and you see it, and they get worse, and you're sort of scratching your head, going, "What's going on?" That little piece, that little nugget, is very, really cool. So, super excited about this upcoming course and really infusing a lot of this information into those core modules. So, if you want more information about the upcoming mastery course, which starts in a week, go to autismmasterycourse.com. And then, of course, if you have any general questions about the course or other courses that we have through Integrative Medicine Academy, you can email us at integrativemedicineacademy@gmail.com.
And Kurt, if somebody can't make the first class, you're going to record it, right? So they can even join the following week.
Oh, yeah, absolutely. So all of our courses, like this one coming up, so the core lecture, of course, I do it live and then it's recorded. So people can jump in halfway in and have all the recordings. So it's all viewable because we have people taking courses from all over the world. So they're not necessarily available at the designated time that I'm doing the live lecture. So yes, it's totally available for them.
And I wanted to make a correction. There's a box called questions. And so if you have questions for either Kurt or I, please just type them into the box and we will answer them.
Yeah, and so there's a couple questions here. So the first one was, the case seems to be suggesting that MMR uncovered or caused autism. Curious to hear what the presenters think. So I'm just curious what you think on that.
So there's a couple of different gene variants that will create that will create a more exacerbated response to certain vaccines, and that NLRP3 actually is one of them that does, because you can't stop inflammation. Now that doesn't mean that every child who has 2 copies of NLRP3 will get autism by any means, but this child, there was a sign that they couldn't stop the inflammation, where they got that huge spike in fever and really got sick. And had we known their genomics before they got that vaccine and they had it, I would have told, I mean, I have a grandchild, and I told my daughter, when you get a vaccine, and she does pediatrics for a living, when you have a child that get a vaccine and they have a big immune response, give them resolvins, which will resolve that inflammasome if if they have too big of a fever. You don't want to give Tylenol. That's not great for the mitochondria. So there is a fair amount, again, of evidence that some children just get an overactivated immune response. And the more we can know about it, the more we can be smart with our vaccination plans, is the way that I look at it.
One thing about Tylenol too is it depletes glutathione.
Right.
So, that's one of the other factors. So another question is, are nutrition consultations available to attendees of IntellxDNA?
So IntellxDNA is a genomics tool for clinicians. We have a lot of handouts. So if you want to go, what can you use to increase magnesium or this or that, that's there. I do have nutritionists that are and a nutritionist cannot by themselves learn IntellxDNA because IntellxDNA is under the FDA, a clinical decision support tool to licensed healthcare providers. That it's the knowledge is appropriate for it. And because we have medications in it, a nutritionist alone doesn't use genomics, our genomics in their practice, but we do have nutritionists that are part of practices that are genomic competent if you want, and we are always happy to give you some of the names of them. But IntellxDNA is not providing the care, the different doctors are, and a lot of the doctors' offices do have nutritionists, nurse practitioners, doctors, they have nutritionists associated with their practices. If you're
Great.
a patient,
Somebody asked, go ahead.
oh, I was going to say, if you're listening and you're a patient looking for IntellxDNA, you would go to the IntellxDNA website and you would put in your location and that you're pediatric, and they would let you know who has and trained fully with the neurodevelopmental report in your state.
So another question real quickly was, when will your next mastery course be after the upcoming one? We don't have one scheduled at this point. So this is a long course. I mean, it's 16 modules. So, it takes a while to go through it. Most people need that time, because of busy schedules and the depth of material. So at this point, I don't have another one scheduled. The one we do have scheduled is starting next week.
I'm going to tell them to just do it. Whoever's asking that question, just do it. There's never going to be a perfect time. The modules are recorded, and if you can't start for 2 or 3 weeks, then you start in 2 or 3 weeks, and then you go back and watch module 1 and 2, because it really is one of the things in pediatrics is it's hard to find a mentor. So to have that really knows autism. So to have that group mentorship with Dr. Woeller, I don't think you'll regret it. I think you'll be so happy to have someone that can take you through as you're working with those patients and getting them untangled.
And one of the things too is we provide plenty of access time to the material. So if somebody needs more time, it's totally fine with us. So, and that's why we record them, because we realize not everybody can. I mean, I'm busy, you're busy, everybody's busy. They can't always be at the live event, but they can watch the recording. So there was another inquiry. It says, and we'll see, again, Sharon, how much we can answer. My son is 9 years old. We did some biomed when he was between ages of 4 to 7. Last 2 years, I have not done anything. He is hyperactive. How can IntellxDNA help?
So we've had a lot on the IntellxDNA website. There's some podcasts as well as some papers. And we didn't know when we first started this in 2016 what age it would help till, but we are finding even in young teens that we're getting some great responses. And there's a paper of a child who was 15 and he had an ATEC of 114. Great clinic had gotten him down to 74, but he was stuck there. And after he got his IntellxDNA, he eventually got down to a 24, which is a huge improvement. You can never guarantee who's going to be a super responder and who's going to get some benefit, who's going to get tremendous benefit. But we've never had a parent with a child with autism regret doing it, because raising a special needs child, whether it's pandas or ADHD or autism, any child with special needs, it's expensive. But we also all as parents, and I'm a mother of 3 and a grandmother of 1, we all want our children to be able to thrive, not just survive, but thrive in life. And so getting that roadmap to them with as much information as possible, I do think will give incremental benefit, even if he's done a biomedical approach, because the biomedical approach can't look at a lot of the things that are related to in the brain tissue expression. So this is if you think about it, your DNA in your brain is differentially expressed, what proteins, than in your kidneys, than in your heart, in your immune system. And when we do blood and urine tests, we're only really getting biopsies or samples from a few tissues. So DNA can be very, very helpful in anything to do with the brain, whether it's cognition in an adult or autism in a child.
And the amount of material that you provide is pretty amazing. Can you talk a little bit about what was the effort that went into, you're not only going to do the testing, but it was the research time to actually be able to find all that information. That to
Yes,
me is what's impressive and so
yes,
useful clinically.
yes. I joke that we had lots and lots of help from PhDs, MDs, research associates with master's degrees and other degrees building this tool. And it was just a year ago that we hired our first salesperson, and we've been around since 2016. Because what we have to do, the process is, first we had to do a literature search and go, what genomic SNPs are clinically significant? So in this case, for autism. Then we had to figure out what that variant does. I had hid the numbers on here just because it's an open talk, and I didn't want all of them sitting. But for each gene, there are maybe 1,000 or more variants with the same name. So you have to know, well, what does this variant do? Does it make you have more transcription, so like more copies of the protein, or less, or make it so it hangs around longer or affects transport? So then after that, you have to go, how can you modulate that particular gene? And sometimes it's obvious. If it's a gene that makes you transcribe 4 times more TNF alpha, you can search the literature for what supplements and things can lower TNF alpha. But then you still have to search and go, well, what can cross the blood-brain barrier and has evidence in autism? So in our autism report, all the interventions have to have evidence for autism. But then there are other SNPs. There's one called SHANK3. We have 2 publications relating to this, because in the literature it was associated with intellectual disability because no one knew how to modulate it. So our research team figured out how to modulate it, and that child that went from a 70 to a 24, he was a double SHANK3, and he had been labeled as intellectually disabled, but he was really non-speaking and floppy because his glutamate pathways in his brain weren't hooked up. And once we knew how to kind of stabilize them and get them going, he was actually a really remarkable, wonderful, intelligent young man. And he plays tennis now, drives a car, got his driver's license, a job. He was wetting his bed every night. So you can look at papers to see kind of how we do. But if someone's comparing and saying, oh, but I can get this number of SNPs cheaper somewhere else, it's not about the number of SNPs and the price. What our research has been is to figure out how you can potentially modulate each gene variant. And that's where it's been a collective effort on the part of, with my science background, as well as many other contributing physicians and PhDs and researchers.
You can do a lot of testing, and then nobody knows what to do with the information. And so what you have is just a lot of markers. By the way, that SHANK3, I believe that's the one that you mentioned, be cautious with using N-acetylcysteine. Am I correct on that?
Yes, and we now have, because it's your glutamate neurons in one part of the brain aren't properly hooked up, and so you're getting less glutamatergic signaling. We weren't sure. I'm going to actually remove that, because the interesting thing about NAC is it decreases glutamate in parts of the brain, but not in other parts, has recently been shown. And because we've had some kids that were really high glutamate for other reasons with OCD, we've had some physicians try this, and there hasn't been a problem at reasonable doses, even up to 600 milligrams 3 times a day. So I'm going to remove that. We weren't sure when we first put it in, and we just wanted people to be cautious, because that research showing that NAC was selective for lowering glutamate at parts of the brain, but not others, had not yet come out.
Another question, and I might jump in on this one, is, what is the role of serotonin in autism? Does serotonin supplementation help autism? Well, the response to does it help would be in certain circumstances. It depends on the child, depends on the circumstances, etc. Any thoughts just on serotonin, and what you've experienced? Obviously, there's SNPs for it too.
Yes, and so we have a depression pathway, and when you get the neurodevelopmental report, you're getting the autism pathway, but also, and all the neurodevelopmental research and the pandas and pans, but also the depression, the anxiety, the OCD, because children don't label what's going on. They don't go, "Hi, mommy, I'm depressed," and so you want to be able to address all the brain milieu. But the interesting thing is, there, with ADHD, sometimes, and same thing even with autism, sometimes it can be high serotonin and sometimes low. So you do kind of have to take each child individually. But the most common thing in serotonin pathways, genomic wise, are SNPs that contribute to not being able to synthesize serotonin. So in those cases, because you're dysregulated, you think you have more serotonin than you actually have. So it's like having a broken thermostat. If the thermostat to your house is set at 70, but it's 40, the heat's not going to go on. And that happens with serotonin a lot. And so then these children or adults don't make serotonin. And then SSRIs aren't going to work till you give more building blocks to push serotonin. So those kids do better with things like saffron and 5-HTP and the probiotics that increase serotonin, and all the cofactors. There's methylfolate and tetrahydrobiopterin and B vitamins and
And you're also testing for SNPs of the tryptophan hydroxylase.
Yes, yes. So, and there's both, and there's ones that affect it in the gut, and there's ones that affect it in the blood. And that's one of the really fun things when you get into genomics is you can even have the same pathway. So thyroid hormone converting T4 to T3. The brain levels can be different than the blood levels. And again, if you're now starting to go, wow, this sounds like too much, I promise you we have a method for training you. If you have gotten as far as ever trying to treat a child with autism, that means you're a lifelong learner. And for you as a lifelong learner, we can teach you how to do this. It's going to make your life easier, not more difficult. So because we're going to map it out and teach you how to map it out and go, what are the 5 or 6 things I need to address first? Okay, what's the next layer? So we have a system.
And that was one of the questions that we asked, what guidance is given when doctors order these tests and need to interpret the results? So I think you've addressed that, but you can expand on that a little bit if you want.
Yes. So we realized that, again, genomics is new, and most of us got none of it in medical school. So you're, again, order just even one report, you're going to have access to our online training program, Genomics University. And then you're also going to have mentorship for your first 3 reports. We're going to walk you through it. There is a small charge for our live training, but that's so we can have good, healthy food and a nice location to learn from. But we do try to keep it inexpensive, and even with that, we give you opportunities to get some free reports as a thank you gift for coming to the live conference, so that it kind of pays its way back.
And another question is Intellax only targeted to the pediatric population, or can it be used for adult issues, anxiety, depression, OCD?
Absolutely. So your DNA doesn't change, and so we have for the mental wellness for adults, it works just as well. If you have an adult that is having problems with cognitive decline or feeling just even a little bit of brain fog, we have a whole report. Many of you may have heard of Dr. Bredesen, who wrote The End of Alzheimer's, and our genomics tools being used in 3 different IRB approved trials, 1 with autism and 2 with cognitive decline. But one of them is with Dr. Bredesen. So we have a report that is geared at medical overview, geared at heart disease, diabetes, osteoporosis. So we have everything from birth. I mean, we're family practice, both Dr. Woeller and I. So I always say my specialty is people from birth to death. You know?
There you go. I like that. This one, let's see. My son has a heterozygous GBA mutation. I'm forgetting what that is. Sorry. That's associated with Gaucher's, which is homozygous. How would Intellax address this mutation if possible?
So if your son, so not every mutation in the GBA pathway actually it might increase the risk of Gaucher's 20 or 30%, but it doesn't mean it's pathogenic. If he actually has Gaucher's, he should be seeing a Gaucher's specialist. The fact that the way you wrote the question makes me think it may not be significant at all. There's a lot of genomics tools. That didn't come from us. We don't put the GBA ones in, because the ones that are pathogenic, you're discovering with testing early on, with some of the testing done in neonates. And most of the other ones are mild contributing ones, so it's not something we've chosen to look at. So that there's a lot of genomic urban legend, let's say,
right.
out there.
Well, one of the things, Sharon, that I talk a lot about is that, you have a genetic disease, for example, or you have an injured individual, vaccine injured, whatever it is. To me, it's all about optimizing potential. What can we do to optimize somebody's potential to whatever that might mean, from a nutritional standpoint, from a functional integrated medicine standpoint, working in the microbiome, all of that. So to me, the testing of genomics is doing just that. We might not necessarily, you're not going to fix the genetic disease aspect, but you can improve health in other areas so that person becomes more functional, healthier overall.
Absolutely. Dr. Anna Herbst, who used to be at IFM, she now is in Arkansas, is presenting at our next conference a case of a child with Down syndrome that she got significant improvements with. Now, obviously, she didn't CRISPR out the trisomy 21, but by addressing the oxidative stress, addressing the inflammation in a very targeted way with the SNPs and understanding what else was going on, she did significantly improve this child's health. And she also did gut testing and some other things. But so everybody, even someone who has a genetic illness, understanding genomics that relate to inflammation, detox, nutrient transporters, neurotransmitters can be very helpful.
So another question is, does the genomic testing help detect bipolar disorder tendencies in kids for potential early diagnosis prior to teen years?
So I don't like to label children. I like to look for root causes. Some of
Right.
the root causes, like CACNA, have, it can be associated with schizophrenia and I think bipolar as well. So there are gene variants in our tool that are also associated with other psychiatric illnesses. We don't have a panel for bipolar or schizophrenia at this time. But again, the different inflammatory things, components, definitely optimizing as much as you can, I do believe can be very helpful. And then, of course, anyone who has a child that has a lot of neuropsychiatric symptoms, you need to think about, could they have a tick-borne illness? Because Babesia, Bartonella, those things can also contribute to neuropsychiatric illness.
So that brings up a good question. Through your testing, are you seeing certain SNPs that tend to be more prevalent in somebody with Lyme or co-infections, or maybe make them more susceptible to problems secondary to those exposures?
So the people who get Lyme disease are people who get bit by a tick that has Lyme. But who is at higher risk for having it in their brain or having it in their joints? There are some SNPs that associate with that and the immune system. It is, if a practitioner is working heavily in the Lyme area, they just need to let us know. It is a panel that is an immune panel that it will be part of the report. It is not showing currently, but if they want to be an early adopter for that panel, they just need to let us know, and we will they just need to get trained on everything else, and then we'll let that panel added on. It's already there, it's just not showing.
And so it looks like, go ahead, sorry.
We're working on it. We had it specific towards Lyme with some of the different things that contribute to the joint pain and the neuroborreliosis. And then we decided to pull it back and expand it to include more of the different toll receptors and other kinds of infections as well.
Sharon, as I think about this, I mean, you've been in practice for multiple decades as well as I have been. And I'm curious, prior to this information for you, when you look back on the types of patients you were dealing with, 10, 15, 20 years ago, obviously you're helping some, and then there were some that you couldn't. But in your personal clinical practice, what kind of changes have you seen both clinically and even from a practice management standpoint of incorporating this genomic information for patients?
So it's not just me, it's me and then feedback from other doctors. Once you start using genomics, people will say, oh, I hate to practice without it. I feel like I'm flying blind. And I think that's very much true. But I think it's not, the genomics is a huge piece. 95% of people in our practice will get genomics. And for some people that untangles a lot, and we get them much better with just that. But I think the biggest exciting thing that's happened in medicine is not just genomics, but our ability to look in more depth. So the cases, interestingly, that I have not been able to untangle with genomics, OATs testing has been the single most helpful test because they're almost all have mitochondrial issues. And then we didn't learn anything about mitochondrial medicine. So I feel like the combination is very powerful. I have a patient who we just did a mitoswab on, who was having a progressive axonal demyelinating disease. And it ended up being a combination of a genetic mild mitochondrial issue with his genomics. He had some genes that didn't allow mitochondrial DNA repair, along with exposure to mold. And, and he was told by specialists, there's nothing you can do. And I have another patient who was diagnosed with completely wrong. They were just giving her steroids, like high dose IV steroids, because they didn't know what else to do. And it was mitochondrial. And yes, her genomics helped, but the combination of those two tests for me has really changed the way I practice medicine with my complex patients.
Yeah, the old, there's nothing you can do about it. I've heard that, continue to hear that.
And
Also,
and also, as kids get older, then they're like, oh, the mitochondrial specialists, they're not going to see these kids for you. You're going to, because it's not a severe mitochondrial disorder, you're going to have to learn to fix it. And that's where, again, what Dr. Woeller is teaching, using genomics, these combinations, we can help you learn how do you help these people with complex illness, because they can be helped a lot of times.
I feel like as I look back over 25 plus years, I mean, I've had some complicated cases going way back, but they appear to be the complicated aspect of many of these cases. Kids just seem to be more exposed to things environmentally. There's just different types of challenges. I don't know how you feel in practice, but it's very rare today to get what seems like a straightforward case. Would you agree? Or
well, I think that those of us that have integrative or functional medicine training, we're going to get more complicated patients, just because the reality is that outside of the insurance network, many times it's hard to. I applaud any of you that are able to do it in the insurance network, but many times it just isn't feasible to have enough time. And so, but I also think that, for example, with global warming, the ticks aren't getting exposed to freezing temperatures during the winters, so they're proliferating and it's spreading. So things actually are getting more common. But I also want to let you guys know, if you're doing a practice and you're learning all these things, don't limit it just to the complicated patients, because some of our most grateful patients are the parents of a child with ADHD or the parents of a child with anxiety, where we were able to untangle it. We have a child that she was not able to make something called tetrahydrobiopterin, which is a cofactor for serotonin and norepinephrine and nitric oxide, et cetera. Well, it's only 4% of the population, and it wouldn't have been something you could test for in any other way. But then her doctor, it was one of my colleagues, gave her tetrahydrobiopterin, and this child who had been on homebound every single year since second grade now hasn't missed a day of school. Or the parent who their doctor wanted them to put their kid on stimulants, but their ADHD got better when all the different nutrient transporters were addressed. So offer it to patients that are relatively healthy with one or two complaints, as well as complex, because especially as pediatric focused physicians and clinicians, they've got decades ahead of them. And even things like, gosh, I need much more B12 because I don't transport it well to my brain, can be super, super helpful to know when someone is 4 instead of waiting till they're 40.
one of the things on the BH4, so the tetrahydrobiopterin, you'll sometimes see a pattern on the oat where the vanillinic acid, the homovanillic acid, and the 5-hydroxyindoleacetic acid are all low or low normal.
I'm going to have to go back to this child, because I think we have OATs testing on her and see. That'll be interesting.
Yeah. And I appreciate you bringing that up, because I've taught the fact that, well, you can't test for BH4. I don't know of a lab that tests for it. It's not like it's not part of the organic acid test. So you're just having to recognize patterns on the organic acid test. But again, it's suggestive of a problem, because there could be other things that might lead to low values in those areas as well. But adding in the genomic information, you're like, oh, there it is. That's likely the main culprit.
And some of the supplements, so tetrahydrobiopterin, whether you use prescription or supplementation, it's expensive. So I think remember, your DNA doesn't change. So it's a one-time investment, and then you can have a tighter understanding of what's going to benefit you. There's some people who don't recycle CoQ10 to the UBQH form, and I've had people where it caused chronic pain or muscle cramps or palpitations even. And so sometimes there's little pieces of information that have big impact. So we hope that you guys will join, both of us, join me in learning IntellxDNA. We have some weeks we have hundreds of patients looking for doctors who are trained. So we would love to get you trained and join Dr. Woeller in his mastery course so that you really feel like you have the skills to help children with complex illness and have a peer support group and a mentor that will help you get across that finish line.
That's great. And, a couple of final thoughts. This kind of testing and this kind of approach is applicable for people of all ages. So if somebody's carrying an autism diagnosis, it doesn't matter if they're 2 or 92, okay? It's helpful across the board. This is not just something for kids. And so that's the same thing with the information I present through the Autism Mastery course. It is applicable for people of all ages. The reality is in this world today where we're sitting now, what is it, 1 in 36 kids with an official diagnosis of autism, 1 in 6 have some type of neurodevelopmental problem. The numbers aren't getting better, they're getting worse. And so 2 years from now, guaranteed, that number is probably going to be 1 in 32 or 1 in 30. So if you are a practitioner that is interested in this, motivated to do this, jump in. There's no sitting on the sidelines and waiting. We need help, and really there's there's millions of people out there who are needing help from qualified practitioners who can help work through this information. Yes, it's complicated. Yes, there's a lot of it, but you start at the foundations and you build the information from there. And I always tell people, you're going to know a lot more 2 months from now than you do now, and 4 months from now you're going to know that much more, and it builds on itself. You don't have to know everything from the get-go to start. You just have to be willing to start and learn along the way. I'm still in the process of learning. I feel like I've been in my residency training for 25 years, and it never ends. So what's so exciting, Sharon, about the information you're presenting, when I dive into these tests and I look at all of the research, I know how much time went into it, from that standpoint. But to be able to access things quickly and have a list of interventions to pull from is something that personally I have felt has been lacking in the world of genomics for a long time. A lot of interesting information, some cool tests, but then you're still left with, well, what do I do? And then the nice thing too is your information is referenced, and that's incredibly important.
Yes. Yes. Well, we look forward to working with you. Again, our next live conference is July 19th through 21st. I have about 8 pediatric faculty that will be joining me, so that you're going to be learning from lots of different people. And 2 of them, just a year or so ago, maybe year and a half ago, were relatively new to genomics. They were doing more. They weren't at all experienced, and they got brave enough after coming to our live conference to not close the door on somebody who had autism and was complicated. They were thinking, oh, I'm just going to do kind of regular pediatrics, and I'm just going to do ADHD and that. And then they had both of these 2 different clinicians, these physicians had parents of children that were non-speaking come to them and say, can you help? And we don't have that many people in the country trained compared to the number of children needing help. So they both came up to me within the same week and told me, I was at a MAPS conference, is why they were both in the same place. And they said, this is my first MAPS conference. I'm just starting to get trained on autism. But guess what? I used the genomics and I already reversed. One of them reversed a child with seizures and speaking and got her verbal and stopped the seizures. And the other reversed a boy who, again, was non-speaking. And again, within a few months, had been able to start to get significant language back. And that was even before they really began their formal coursework in autism, just using the genomics as a tool and following it. So with all the resources that are out there for you, if you want to help these children or any children in a precision way, we're here to support you.
Awesome. Well, Sharon, thanks so much for your contributions and presenting this fantastic information. Anybody out there, please reach out to us if you have any questions. Again, interested in the course, the Autism Mastery course, email us at integrativemedicineacademy.com or check out the information at autismmasterycourse.com. Okay. Thanks so much, everybody. Take care.
Thank you.